Good evening, everyone. I'm Carly Parkinson. I'm going to discuss my critically appraised topic of traction for low back pain in patients with degenerative disc disease. So what is traction? Traction can be defined as a therapeutic modality that draws tension on the spinal column, allowing to increase space between the vertebrae. Traction can be achieved by mechanical force, positional gravitational force, or manual traction from a clinician. So what is degenerative disc disease? Degenerative disc disease is a disease that causes the space between the intervertebral disc to narrow and cause pain because of pressure on nerve roots and other structures. You can see here in this photo how this is a normal intervertebral disc, and then how the space is decreased, causing the vertebrae to eventually touch, creating also a little arthritis pain. So why should we use traction? What's the purpose of traction? It's to relieve the symptoms that are produced by the narrowing of the intervertebral spaces that can cause increased pressure on nerve roots and increased facet loads. So if we use traction, we are decompressing these structures, allowing for the disc to return to normal size, full of fluid, and the nutrients that they need. So if we are widening the space with traction, we can alleviate the pain caused by discogenic disorders. My search strategy for this topic, I initially completed a computerized search in June 2019, and then a second search in July 2019. I looked for individuals with degenerative disc disease, lumbar and traction, and then either control or no traction. The outcomes I was looking for were measurements of low back pain. Sources, they looked in PubMed, EBSCO, Medline Complete, Sportdiscus, Science Direct, and Google Scholar. My search results yielded 5 relevant studies, except for 2 that were excluded. They did not meet the inclusion criteria. 1 was only available in Russian, and the remaining study was only a published protocol. All 3 studies used a form of traction to relieve low back pain from degenerative disc disease. When we compare the studies, we can see the differences between Beatty et al., Schemmel et al., and Bakai et al. You can see that the Pedro scale ranges from 11 out of 11 with a high level of evidence being a level 1 all the way down to a 4 out of 11. The Beatty et al. Was a case series. The other 2 were randomized controlled trials. So you can see the outcome measures here from Beatty et al. With the NPRS score decreasing from 5.8 to 3.7, Schemmel et al. Decreasing on a VAS scale from 0 to 100 from 61 to 32, and then Bakai et al. On a 10-point VAS scale, 6.03 to 3.92, and then 6.55 to 2.89. So when we're looking at this evidence, we do see, because of the meaningful improvements in pain outcome measurements, that we should be using, there is a moderate evidence suggesting we should be using traction as a therapeutic intervention for relieving pain in patients with low back pain and degenerative disc. My implications, I noticed that from the evidence that we definitely should be using lumbar traction. These studies do indicate that it's a clinically relevant modality, providing improvement above the minimal clinical difference in patients with low back pain from degenerative disc disease. However, we do need more evidence. Thanks so much for participating, and if you have any questions, please feel free to reach out.